Hello, Pahrump. I'm Dr. Reiner, and tonight's Independent Doctors at Pahrump show. This is Monday right after Thanksgiving. Hope everybody had a good holiday, a safe holiday, didn't eat too much, and if you did, I hope you managed to get up and walk that off, as I've tried to tell everybody to do, is to walk after you eat. It's the only thing you can do to help stem the tide of weight gain and diabetes. So again, 727-8750 is the dial-in number for you to call in with your questions or concerns. Usually I've been having a larger number of callers, and I've been excited about that because they always prompt good topics for discussion and bring up the things that are on your mind. And hopefully I can answer those particular questions. Sometimes I plan things for the show, but as those turn out, we usually get callers, and that usually interrupts those particular topics. So again, in the office today was a normal confusing Monday. With that being said, same issues seem to always come up. And then today was a lot of medication refills for pain, and there was also a couple of patients coming in at the end of the day getting their marijuana forms filled out. And unbeknownst to me, oh, we got Ray. Ray, are you on the phone?
Yes, I am, Doctor.
Good. How are you doing?
I'm doing all right. You know, a few years ago, I'm going to ask you a question that about 6-7 years ago, I had a problem walking with my right leg, and it was like a pain shooting down there. And people said it was sciatica, and I didn't know what it was. And what I tried is a physical pressure into my hip, and eventually the pain eased up, and I was able to walk normally again. Is that some kind of treatment? Is there some kind of thing that you can do? It was actually just me pressing in in the hip bone, and it seemed like gradually it went away. It was so bad that I'd be walking and my right leg would just give out. And naturally, I got their walking stick, so it saved me. So have you explain that a little bit, and I'll be listening.
So were you pressing on your back, or actually on your hip, on the side of your hip, or in your low back?
In the buttocks part.
Okay.
You know, right in there. And I put my thumb in and I press it. And sometimes I get up in the morning and I have a similar problem, and I just do a little bit of that pressure, and it seems to go away. And okay. I'm thinking maybe direct pressure would help some people out, and I wanted to point that out to you.
Yep.
And if you can talk about it a little bit, I'd appreciate it.
Sure.
And congratulations, you're on the air live. I love it.
Yeah. Well, I trust me, it was a confusing Monday, and I was gone for the holidays, so it's always crazy. But I do try to make the effort to get out of the office and cut my patients off at about 3:30, so I can try and. It usually takes me that long to get here, but yeah, I certainly enjoy being here when I'm not traveling. So I'm glad.
You got a good show, and
yeah.
I'll listen off of the phone. I'll listen on the air.
Okay. Well, thanks for those accolades. I appreciate that, and I'm glad you call in. You always have great questions that prompt a lot of good topics. Let's see, sciatica as well as arthritis of the hip, degenerative disc disease. Those are all common problems we see a lot of. They're chronic pain problems. Sometimes they're mixed together. It's hard sometimes to tell when someone has a hip problem versus a disc or a back problem. Arthritis, as you know, degenerative arthritis is a wear and tear of the body, and it can affect any particular joint. Probably more so than others, the joints which we use a lot, obviously shoulders and hips and knees, they get a lot of motion. And those are synovial joints, at least the hips and the knees and the shoulders. And what they mean by synovium is there's actually a lining of that joint. And actually all joints have synovium to them, but the bigger ones are probably the ones more likely to have these particular problems. But you do get degenerative arthritis in the distal part of your hands. This is called the middle and the distal interphalangeal joints, and then you have these which are called the metacarpals. And in your foot, they're called metatarsals. But this is a synovial joint more than these are, and this is where rheumatoid arthritis would affect the synovium, and that's an autoimmune disease. And that's where the body attacks the actual lining of the joint. And that particular pain is going to be more often as you use the joint. It's going to become redder and more inflamed, as opposed to degenerative arthritis, which is very stiff and painful when you first move the joint. And 90% or 95% of the arthritises that we see today are degenerative in nature, chronic and overuse syndromes, where the lining of the joint tends to wear out over time. If you were a football player in high school, if you did a lot of sports and you're very active, those particular joints do wear out over time, and you get the cartilage and the fluid in there tends to dissipate, and so they start to wear out, and they become very painful, so that when you actually start to move them, when you sit for a while, those joints will actually gel and they'll actually come together. And as you have to get up to move, you actually break them apart. And that will cause degenerative type of arthritis. Let's see, we have Kathy on the phone. So Kathy, are you there?
Yes, I am.
Okay, what can I do for you?
Yes, I have been diagnosed with pre-diabetes.
Okay.
My A1C is, the last one was 6.3. I started out at 6. I'm on metformin. My question to you is, did I acquire this because I ate a lot of carbs throughout my life? I don't now. I've really done my homework, and I know that I have to stay away from carbs and sweets, and I do that pretty good. But what I'd like to know from you, exactly what is pre-diabetes or diabetes? Is it because my pancreas doesn't work?
Mm-hmm.
Is it because I just would like it explained to me what exactly is going wrong in my body to cause this?
Okay. And so, Kathy, I appreciate that call, and I want you to hang on through the break, listen to the show, and I will pick that topic up. I have about 4 minutes left before the break, and I'm going to finish up Ray's discussion of the arthritis, and then I'm going to bring up your diabetes and your abnormal HbA1c, and we'll talk about that. And so hang on, and I will get to that, because that's a very good topic. I talk a lot about it on the show.
All right.
So just hang there. So anyway, back to the arthritis part of that, which is basically the degenerative part. And so, Ray, when you press in on your joint and you press the hip, or you manipulate your low back, which is not, it is a degenerative form of arthritis, you're repositioning, and that sometimes will help that particular pain. The fact that you were hurting and the pain was shooting down your leg more with walking in your low back, it could have been a combination of both. And so again, that's going to be painful stiffness in the morning. As you get to exercise your back, you'll free that up, and it will be reduce some of that pain in your low back. But if the joints in the back, is a little bit different because they have pedicles that line, and I don't have a good bone diagram to show you that, but you have vertebral bodies which stack like Hostess cupcakes, I guess would be the best thing, and then basically the spinal column runs right next to it, and then you have what they call these pedicles then, and they basically protect the spinal column. That allows your back to basically flex, but it doesn't allow it to extend. It actually puts a lock on it in there, and those joints rub together, and that causes pain. And if they become inflamed, they can inflame the nerve roots, which exit right above and below the pedicle, and that's called a neuronal foramina, which is where the nerve actually comes out. Now, if they become inflamed, they actually can irritate the nerve, and you can get that. If a disc ruptures, and they do wear out over time, again, they're cushions. They're like bushings in a car. They'll wear out, and when they do, they're going to allow the pedicles to ride closer together, which causes more arthritis, and they can actually encroach if that disc bulges onto the nerve root. Now, if that disc ruptures, it will compress that nerve root, which will cause an extreme amount of pain suddenly, all of a sudden, and will bring you to your knees. So that's a totally different type of pain than one where you basically get this chronic, irritating pain in your low back. And there's a good book out there. It's called Treat Your Own Back, and it's on Amazon. It's by McKinsey. It's like $9. And I suggest that if 90% of the people who suffer from low back injuries or chronic low back pain, get that book, because that's a very good diagram. McKinsey was a physical therapist and developed the McKinsey method for treating low back pain. And like I said, it's about that book, that thick. It's $9 on $9 or $10 on Amazon. It's called Treat Your Own Back. And I suggest to everybody that has chronic pain in their back that they get this book, because it gives you the home physical therapy method of taking care of your back, meaning correct posture, good exercise programs, and that's really what it is all about, is maintaining the normal curvature of the lumbar spine. Because most people, if you imagine that when we flex forward, we break that normal lordotic curve to our back. That's why lumbar rolls are important, because you basically maintain the back posture. So again, your neck has a little S curve, your thoracic spine has this, your low back does this, and your tailbone does this. So this is the natural curvature of our spine. And the more we maintain that, the more we maintain alignment, and the more we can reduce that pain. Okay, we're going to break, and then we're going to come back, and then we're going to bring up Kathy's call about diabetes. So stay tuned, and looks like it's going to be a good show tonight. Thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.